Roper St. Francis Healthcare's House Calls TV.
When someone is diagnosed with a hernia, the use of mesh as a surgical option should be discussed with your surgeon. Dr. Damon Simpson has more.
Hernia is a defect in a muscle wall. In some people, the tissue is never going to be strong enough to just suture together by itself or sew together by itself. And in those people, we reinforce it with mesh.
Your family history and other factors can help you and your surgeon decide if mesh is needed to prevent a recurrence.
We're using a variety of meshes, some of which would be ideal for a particular patient. Patients should sit down with their general surgeon and have a conversation about their particular hernia and some of their medical issues that may increase the risk of recurrence or complication.
Other things to help prevent hernia recurrences and complications include weight loss, smoking cessation, and diabetes management.
A majority of the studies show that mesh drastically reduces the risk of recurrence while not increasing the risk of complications to an appreciable degree.
For more information, call 843-402-CARE. And for more House Calls TV, visit us online at rsfh.com. I'm Angela May.
Roper St. Francis Healthcare's House Calls TV.